Yeah, as a chiropractor, we will refer people to medical doctors if we think that they're not a good case for chiropractic. Are there certain cases in particular, are there certain experiences that a person might have that we might send them out to a medical doctor? Absolutely. I would send, if I thought maybe somebody had a fracture, I would absolutely send that person to get an x-ray. That's you want to know if there's a potential, fracture in a bone, and you don't want to adjust that bone. So I would send that person out to get an x-ray and figure out what was going on. And then if there was no x-ray, then we would proceed from there, and I would move on with adjustments at that point. Anything that's really acute, like a sudden onset of a very acute headache, that's not common. Like if you have migraines, if somebody has migraines, that's different. They've been getting them for years and years, and not that that's not a horrible experience. It's not fun, but I would feel comfortable adjusting them because this is something they have all the time. If somebody got a crushing headache that they've never had before, and it was very acute, I would definitely send that person out to get some information from a medical doctor and find out what was going on, maybe an MRI, to see if there was something going on in the brain. Most cases that come in are very good candidates for chiropractic care, like sports injuries. Those are great to have come in because if you take a sports injury to the hospital, they might just give you an anti-inflammatory or a pain medication, a muscle relaxer, and that's not really going to help that heal. And the same thing for like a motor vehicle accident. If you end up with a concussion and you go to the hospital, they're going to check for any very acute problems, and that's great. And then they'll probably send you home and say, well, he or she has a concussion, but there's no treatment that goes along with that. And chiropractic, that's where chiropractic comes in, because we can really help that person to heal, and feel much better after that accident, or after that sports injury. Especially if it's in like an extremity. So if somebody injures their knee playing soccer, for example, we could adjust the ankle, we could adjust the hip, and we're not going to adjust the knee maybe because it's just a little too acute, but boy is that knee going to feel better once we adjust the ankle and we adjust the hip. So it's great to have kids come in and really help to rehab that injury, because it will make their life later on much more pain-free. Chiropractic is a wonderful option for someone who does not want to have invasive procedures. It's really about allowing the body to heal itself. It's about the innate capacity of the body to heal itself, and chiropractors really work with that and want to deliver a clear, clean signal to the nervous system to help it really heal the body. Chiropractors don't do the healing. The body does the healing, and we're just there to guide it. If we can give a good adjustment and really help that person's nervous system to take over and heal the body, it's, very powerful.
Thank you for watching A Wise Way. Subscribe to stay updated, share to pass the knowledge, or view our other videos on the left.